I'm Benis Abubedu Lansa. We are coming to you from digital address GA0992539 at Kokomlimli live on DSTV channel 421 and GoTV channel 144. Now, at the shopping mall, school, court, banks and other places where many converge to access a particular item, value or service, it's common to hear phrases such as first come, first serve and the early bird catches the worm. Now, they are usually used to promote fairness and organize people to avoid chaotic situations. While in emergency cases, those who came last may be served ahead of those who came earlier. How so? Matilda Bomega looks for answers in this JoyNews Health Desk special report.
At every point in time, whether morning, afternoon or night, there's a critically ill patient requiring more than the normal interventions from the emergency services staff to stay alive. Similar to a busy restaurant, if it's packed, there's going to be a longer wait line. Unlike a walk-in, an emergency room is not a first-come, first-served place. Emergency department professionals have to determine the severity of a patient's ailment and recognize if they need medical attention urgently, and they do this with a process called triage, which simply means to sort. This process is what sometimes accounts for the long wait in the emergency room, leaving people frustrated and angry at health professionals. Emergency physician at the Greater Accra Regional Hospital, Dr. Edem Komla Nani says, whilst waiting for medical attention may seem tedious, it is important for people to understand the process.
The reality of the situation is whenever you arrive in the hospital, you are not the only person to be taken care of. When it comes to emergencies, every second is of utmost importance. Every second counts. A patient could lose a life if care is delayed for a while. So what we do in the emergency room is not about first come, first served. We have a formal triaging system that we use, which helps us to tell whose illness is more severe than the other, so that we can take care of the more severely ill people before we get to the less ill people. So yes, that to some extent brings dissatisfaction for those who are less ill, but then in the long run, it actually brings the most good for the most people, in that at the end of the day, we get to save the most lives. And because sometimes the communication may not be as good as it should be, the understanding isn't there. I think the other thing we may have to improve is the communication with our patients, so they understand that it's not about first come, first served, but whose illness needs the most urgent attention.
But the procedure from pre-hospital care through to the emergency room can be daunting, with lots of possible outcomes running through your mind. At the moment, the country has between 50 and 60 functional ambulances. The widening gap for pre-hospital care, transportation through to the emergency room, where the no-bed syndrome continues to claim lives, remains a big issue in the health sector. At the Greater Accra Regional Hospital, a department is dedicated to emergencies. Dr. Emmanuel Sropenyo is a medical director.
We have put in place a series of strategies. One of them is to set up what we call bed management committee. And so this is a team of doctors, nurses, and administrators. And then their job is to go around the hospital or the walls and make sure that wherever there is bed, they mark it, that there is a bed here. And then when the emergency department is getting full, then patients are transferred to those places so that at all times we have bed at the emergency department. Another strategy we put in place is what we call functional usage of bed. You know that in the past there are some departments that may be busier, or sometimes their patients stay longer. For example, the medical department, the patients tend to stay longer because these are elderly people who may have stroke and the rest, so they don't go home, compared to some other department that they come for surgery, your surgery is done, you go. So sometimes there there are beds in some department and there may not be beds in another department.
CEO of the Ghana Ambulance Service, Dr. Ahmed Zakaria, says whilst the service awaits to take delivery of the 270 ambulances promised by government next year, there is an urgent need for schools to train people in basic first aid.
We can bridge the gap by training what we call volunteers and first responders within the communities. You know, if you go to many developed countries, every average person within the community is trained in basic life support skills. So when that happens, even in the house, the individual is able to start some first aid before they send for the emergency services to arrive. So we should be able to get into the communities, target the communities, the drivers, the schools. But I would even recommend that we catch them young, and therefore we should be able to include in our curricula first aid training. So that once we know that every child is trained in some basic life support, the child grows with it.
Meanwhile, the Greater Accra Regional Hospital has taken delivery of advanced support ambulance with equipment and medications on board to deal with emergencies. For Joy News, Matilda Bumaga, Accra.